Good afternoon, everybody, and thank you so much for joining us on where I am, a very windy Friday. Thank you for joining us for another one of our amazing Meet the Specialist seminars. I'm going to ask that everybody please remain on mute through the session. At the end of the session, though, there will be an opportunity for you to ask questions. The reason I want you on mute is so that noise from your home or workplace doesn't interrupt the speech recording. At the end of the session, as I said, you'll get the chance to ask questions, but if you have to go before the end, you can always type your question into the chat and I'll make sure that it gets asked. Pardon me, when you've gone.
Sorry, Michelle.
And of course, you'll receive the recording within a day of your team as well. As you know, all of our sessions, Medico-Legal Assessments Group, YouTube, you may have missed previously. Have I gone again? Am I back?
I think you're back.
Tom?
Okay.
Great. Okay. All right. So without further ado, I'm going to hand over to the very amazing occupational therapist, Mr. Tom Cleary, who's going to talk about a very interesting topic, and that is driving assessments, but particularly with respect to mental health and cognitive decline. Thanks so much, Tom.
No problem. I hope has the slide turned up for you, just to be sure?
Yes, it has.
Great.
Yes.
Okay.
Yes.
So look, thank you all for attending. So as Michelle said, my name is Tom. I'm an occupational therapist. The focus today I really want to talk about is mental health and how it cognitively affects people's capacity to return to driving. And the particular focus when it comes to this aspect is PTSD and generalized anxiety, with PTSD probably being the predominant condition which we see. So look, I thought it'd be good just to introduce myself a little bit. So I've been an occupational therapist 20 years now. My primary clinical focus has been on working with young adults with brain injuries. And I suppose the development on from there has been looking at some of the cognitive aspects around returning to driving. I've worked in a variety of settings, so both as a clinician, which I still do some work in. I've worked in-house in various life insurers. I've done vocational rehab, and these days really my focus is on driving assessments and medical legal assessments. Through the process of starting OT driving assessments, what I started to come across was a lot of people who were starting to ask questions about whether they needed to be assessed for their capacity to drive due to a mental health condition, which wasn't as much of a focus as some of the physical conditions or neurological conditions that were almost automatic triggers for GPs to send somebody for an assessment. And we have created a program whereby we look at how do we support people in this regard, how do we create an assessment process, and how do we better create some awareness about how difficult it can be for somebody who's really struggling with, in some cases, being housebound and being unable to travel and not really understanding how to access some of the support they need. So the structure from today, I'm going to take you through a little bit of history around where OT driving is, what the assessments involve, some of the conditions and how they relate to our assessment process. I have a couple of case studies of some clients who I've worked with just to try and put a little bit of context around that as well for you. I've got a couple of little questions that I might get you to do at home. You don't have to speak up and answer any questions, but you can just play along in the background. As we're doing that, I'll explain to you how some of my clients struggle with some things that, as you will see, should be very straightforward. And then I'll try to leave about 10, 15 minutes in the end for some questions, just anything coming through. So as Michelle mentioned, if you do have anything that pops up along the way, please just jot it down, and I'll happily try and address that at the end. So, occupational therapy driving assessment. Occupational therapy driving assessments are something that a lot of people don't really come across unless they have either a loved one who has suffered some kind of medical injury, whether they've had some kind of injury, accident, or disability themselves, or if they've got a family member who has reached a certain age threshold whereby their GP is no longer confident to say that they're safe to drive and they need to have an assessment. Traditionally, driving assessments were conducted by a GP. They would ask a couple of questions around orientation and how somebody was coping. They would do an eye check, and if everything was good to go, their license was cleared for another period of time. Over time, it was realized that that isn't the safest way of determining who is safe to drive and who isn't. There's a lot of focus, particularly around neurological conditions, and particularly around neurological conditions because there are so many varied aspects to somebody's capacity, whether it be their physical ability to control the vehicle, whether it's their cognitive capacity to make correct decisions at the time, or sometimes you get sensory loss. So you could have a visual spatial inattention, which means that they're unable to see things in certain aspects of their vision and they just drive straight through them. So OT driving assessments have been developing and over time, and at the moment I use a program called OT DORA, which is an internationally recognized assessment tool where we look at a real complete picture of how somebody is coping. So the assessment process itself, I will talk to somebody about their driving history, any incidents that they've had, what concerns they've got. Then there is a physical screen of their abilities. So I want to make sure that they are physically capable of checking their blind spots, physically capable of turning the steering wheel as needed, able to react quickly enough that they can alternate between brake and accelerator, or they can physically turn a wheel quickly if something happens, somebody runs out in front of them. Following that, I'll do a cognitive screening. So you'll see a little bit of that today. Now that will be more complex for some people and less complex for others, depending on how the assessment's proceeding and what their medical history is. I will ask them some questions around driving itself. So try to get a little bit of an understanding of what is their knowledge of road law, roadcraft rules. And then I'll do a sensory screen too. So things like an eye check and potentially some inattention tests. So OT driving assessments are really needed to make sure that somebody is safe to drive in a vehicle and for how long they're able to drive in the vehicle. Driving is something that we often consider as a right these days and something that's essential. And particularly depending on where you live, it might be your only means of accessing the community, picking up your shopping, dropping your kids off to school, whatever it might be that you need it. But when you're driving a vehicle, you're also in control of something that can potentially kill somebody. And we need to make sure that anybody who is behind a wheel is safe to do so, both for themselves and for every other road user. So when it comes to who refers for a driving assessment, there are a variety of methods that people come to me. Sometimes I will have somebody self-refer, so they have their own concerns around their driving and they want to make sure that they have a full screen of that. Often I will have people who are referred from the licensing authority. So here in New South Wales, that's Transport for New South Wales. So that can be because, for instance, they were in an accident and when the police attended the accident, they had concerns about that person's safety. So they notify Transport for New South Wales. Probably the most common method of getting OT driving assessments are when the GP refers for one. So it can be a GP or a specialist who sees the client themselves and has concerns that they may not be safe to drive anymore. That medical doctor can put a suspension on that license straight away and say, you need to participate in an OT driving assessment to make sure that you are safe to return to driving or to continue to drive. With particularly the mental health claims that have come through to me, a lot of the time, those steps have been missed. And actually it's been flagged by either an insurer or sometimes from the people themselves, where they've spoken to their GP, they've said they don't drive anymore, but nobody has ever considered, well, actually, are they safe to do that? Would they be capable of doing it? The ones from the insurer are quite interesting because these are the ones that I feel are really missed in the community. They're the people who are very restricted and nobody is really thinking about. And they're the ones we're trying to raise some awareness of and say, well, actually, we have a service in place and we can try and help these people. So I've already spoken about what's involved in OT driving assessment. So capacity to drive is often not considered mental health conditions. And being unable to drive means that person can struggle to work, participate in social activities, take their children to school, perform activities like shopping. If you think to yourselves, all those times when you hop in a car and just go and do something, imagine you were suddenly in a situation where just trying to do that causes you high levels of anxiety, causes you to panic, and suddenly how much does that restrict your lifestyle? So PTSD and anxiety can either prevent people returning to driving or result in them being unsafe to drive. Being unsafe to drive can mean that they feel pressured into having to try and participate in these activities. They feel pressured in having to try and take their kids to school or pick up some shopping, but they do it in a very unsafe manner. And they might get away with it for quite some time, but they're always going to be a danger to themselves and others. So the big concerns, people reacting unexpectedly, is particularly with PTSD, people get flashbacks of the accident that happened to them. If a vehicle has struck them from the side, suddenly anything that approaches from either the left or the right-hand side, they can suddenly turn the wheel, driving onto the wrong side of the road, or braking suddenly and not giving any warning to the vehicle that's behind them. I've had clients who close their eyes when something has happened. So either they've gone through an area where the accident has happened in the past, or somebody's come up aggressively from a driveway and they've just shut their eyes. And they're steering erratically. Also, when they start to panic, so they make very big movements instead of smooth, controlled movements that we would expect from a driver. I've had clients who are unable to sit as passengers. I've had a client who could sit as a passenger but couldn't even sit into the driver's seat. And with some of our clients, we start as early as just letting them hear the accelerator of a car. I've got a client who I worked with recently who lives on a busy road where there's a garage opposite, and every time the garage starts up a car and tries to rev it, it causes a trigger for her. And the last one, I spoke a little bit about closing their eyes, but it can be a real challenge to go through an area where the person has had an accident previously. And we try to build this into our treatment program where it's gentle introduction back into an area where somebody feels really unsafe. And you can see the physiological changes in people as you're approaching that area. They can often start to sweat, they become pale, they start to tense up. So it's about how do we introduce somebody through these areas again to desensitize them towards that. We've had questions in the past from clients about, well, why can't I just completely avoid that area forever? But we've also had clients who have suddenly had roadworks on a road, they've been diverted through, and they've had to go through an area where they had an accident previously, and all of a sudden they're confronted with it without any gentle exposure. And that can be very confronting. So I'm sure everyone knows what PTSD is, but I thought I'd just, a little refresher. So post-traumatic stress disorder is a mental health condition that's triggered by a terrifying event, either experiencing it or witnessing it. And symptoms may include flashbacks, nightmares, and severe anxiety, as well as uncontrollable thoughts about the event. So common symptoms of PTSD are vivid flashbacks, so feeling like the trauma is happening right now, intrusive thoughts or images, nightmares, intense distress at real or symbolic reminders of the trauma, and physical sensations such as pain, sweating, nausea, or trembling. Now, with these symptoms, I'm sure you can see a lot of these, as we spoke about previously, are really dangerous when these people are starting to get back driving again. So the vivid flashbacks are very common for people with PTSD returning to driving. And the flashbacks can either be when they're thinking about how they would have to drive, often the night before. So those nightmares, it can be 1 or 2 days before they know that they're coming to meet somebody like me, and suddenly they're having nightmares and unable to sleep because the thought of having to sit behind a car again and what might happen. The intense distress and the physical sensations, like I mentioned with driving through an area where you've previously had an accident, that pain, sweating, nausea, all of a sudden people start to make poor decisions because they're under such physiological stress. So generalized anxiety disorder. So generalized anxiety is usually identified when for 6 months or more, on days more than not, you have felt very worried about one or more event or activity, found it hard to stop worrying, found it hard to do everyday activities because of your anxiety, felt restless or on edge, felt easily tired, had difficulty concentrating, felt irritable, had muscle tension, or had trouble sleeping. Now, this is a list that's taken from the Black Dog Institute and a list that's commonly accepted. Every time people look at this list, people say, well, I often feel like this, or I often feel some of these symptoms. It becomes an anxiety disorder when you have these symptoms, but they don't go away. And you have them for a long period of time, and they start to take a significant impact on your life. A lot of these symptoms compound on each other. You start to worry, you feel restless, you don't sleep well, all of a sudden you have difficulty concentrating. You have irritability as a result of that. When you feel tense and anxious, you physically strain your body. So that's when you start to feel muscle tension, such as jaw pain or sore backs. And the difficulty sleeping, I often find when people with poor sleep hygiene really, really struggle to functionally operate well because everything becomes more difficult. So clients would refer to my service. They've often not driven for a long period of time. I was looking back through when I was preparing for this for some of my clients. Some of my clients haven't driven for almost 2 years. They have been sitting at home, they get Ubers and taxis wherever they need to go, or their partner drives them to any appointments they need to. They become very reliant on people around them to do things. Some of them tried to return to driving, but had really negative experiences. So they were already stressed, on edge, probably made some poor decisions, and somebody honked the horn at them, and all of a sudden it was just too much, and it set them back even further. So these people are often highly stressed. I've had clients who have told me they haven't slept for days prior to the assessment. They're so worried about having to go back in a vehicle again. But a lot of these clients have no restrictions on their driving license. Nobody has ever spoken to them about this. So from their perspective, they could just hop in a car and drive 3 hours because there is nothing restricting them from doing so. But from a safety perspective, they would be a danger to everyone around them. So they've often spoken to their treating medical team, and they've just been advised, well, only drive what you feel capable of doing. Or if you don't feel capable of driving at the moment, well, just don't drive. A lot of these people aren't working anymore. They don't visit their friends and family. They become really socially isolated. When somebody suffered a major traumatic event, they often become socially isolated in any event. All of a sudden, they're not working anymore. They don't want to have the repeat conversations with friends and family around, are you still recovering? How are things going? Are you still, why are you not back at work yet? When do you think you'll get better? All of these questions that can be quite confronting for people. And when you add in an excuse to be unable to get to one of these social activities, well, I can't drive at the moment, or I'm not driving, and it's very easy to spend more and more days in your home and really struggle to start to plan out how do you do things outside. When somebody is struggling to do social activity, when you hit another barrier of, well, actually now I can't get there, or I have to book a taxi and it's going to cost money, and if I want to leave, then I can't just go, I have to wait until somebody comes to pick me up, or a taxi arrives, they start to build real avoidant behavior. And what we really want to do by giving them their independence back in driving is to actually encourage these people to go, well, look, you can drive now again. You are able to participate in these activities. Let's start to encourage you to be functioning in society again. So some of our clients can drive locally, but as soon as they go onto faster roads or they have vehicles merging in front of them, that's when they start to panic. So some of our clients will just focus on the road directly in front of them. So they get that tunnel vision and they lean forward in their chair and you can see them staring straight ahead, and they're looking at the car in front and they think, no matter what happens, I know what that car is doing. But they're not watching what anyone is doing left and right. They're reacting slowly to traffic lights. They're not looking for pedestrian crossings. They're just missing all of those peripheral vision aspects. When they're driving in familiar locations, a lot of our clients can do quite well, but as soon as they're taken into an area where they're not familiar or roads that they haven't driven on before, they begin to really struggle. They become highly distracted. And we talk about divided attention. So as soon as they have to plan a route as well as operating the vehicle, they struggle to do the two things at the same time. So when they're driving down to the local shops, they know exactly what road to take. They know when to anticipate if there's going to be traffic in an area or not. They slow down, they speed up. And then as soon as they're outside of that comfort zone and they don't know which turn to take next, all of a sudden they're veering left and right, they're braking unexpectedly, they're driving far too slow for the conditions. So when somebody gets sent to, when we get a referral, no matter where we get it from, the first step is I will go and do an assessment with the client. So we have two parts to the assessment. There's what's called an off-road assessment and an on-road assessment. If the off-road assessment is the battery of cognitive assessment, physical assessment, and sensory screening that we spoke about. If at the end of that assessment, somebody is really struggling, we will not proceed to the on-road assessment. But most of our clients, we're able to get to a point where we're able to plan out some level of an on-road assessment with them. The on-road assessment is with the driving instructor. We will always go in the driving instructor's vehicle. And the reason for that is the driving instructor has a secondary brake. And if the person does not react in time or doesn't see something that they should, the driving instructor can stop for us. I've had a lot of clients say to me, well, I'm used to my car. This is a new car. It's too much of a change. We will never go in a client's car because if they make a mistake at that time, there is nothing we can do to stop them. With the on-road assessment, I will plan out what I want to see during that time for that client. So if that person is particularly nervous, very low in confidence, and I can see that we might be able to get them on the road, but we're not going to get them that far, I will plan the on-road assessment with the driving instructor to stick around their local area. Let's take them somewhere familiar, build their confidence, make sure that they're given lots of positive reinforcement where they go so that we can build a program on from there. If we think that they're going to be okay with that, but we're not sure how they're going to be in more complex environments, it is preferable to try and expose them to a little bit of that and see how they react. That gives me a little bit of context going forward of being able to say, well, I think we can work on slowly introducing some complex scenarios to them in a very controlled environment. At the end of the assessment, I'll produce a report and I'll set goals with the client. So the goals will always be around, particularly with the PTSD clients, it will be around gentle exposure to stimulus in a controlled manner. So what we want is, we want them seeing cars coming from side roads, but we want them to know that actually that's okay, that car is going to stop. And what happened to you on that one occasion is not something that's going to happen repeatedly. But also teaching them some defensive driving techniques. As that car is approaching, if it's coming very fast, how do you control your speed in advance in case they do something unpredictable? And the driving instructor would start to give them tools around that. If somebody's overly focused on the road in front of them, we can use what we call commentary driving, whereby we say to them, I want you to actually read out every traffic sign around us. So what they're having to do is they're having to scan left and right. They're having to relax a little bit. It will slow them down in the short period of time, but over time, it helps them to just improve that scanning, improve their ability to see what's around them. With all of our clients, I usually review them again after about 10 sessions with the driving instructor. I find it important to then review their goals, see what's progressing, what have they really started to improve on, and what areas are they still challenged, and then set a new set of goals again. Okay, now we want to work on changing lanes at higher speeds, for instance, or we want you to work on driving through shopping center with multiple stimulus around you, and how are you problem solving all of this? Now, depending on how somebody's performed in that initial assessment, I will always report my findings back to the reporting body, for me, Transport for New South Wales. Now, what that might mean is a downgrading of their license. So, for instance, some of our clients who drive far too slowly and are just unsafe to be driving by themselves, I will downgrade them to a learner's license, and I'll put a restriction that they can only drive with a driving instructor. So what that means is I can control when they go out and what kind of intervention they've got, so that I know that they're going to be safe when they do drive, but I also know they're not going to go in the car and try and do something unpredictable. That can be very confronting for some of our clients, because as soon as somebody says, I'm going to put you back on a learner's license, they think I'm going to have to do a full test and redo everything again. Try and reassure them that I can alter that license again. We can bring them back to where they were, but it's all about safety. It's about making sure that from a legal perspective, they are not certified to do something that they are not safe to do. As they progress through the program with us, sometimes I can start to increase their capacity with that. So for instance, with clients who are starting to build the capacity to drive around their local area, are very confident, but I still wouldn't feel safe if they got on a motorway and tried to do a longer drive, I can put a geographic restriction on them. So I can upgrade them back to their full license, but say, you can't drive more than 5 kilometers away from home. That allows them to practice a little bit more, but it also means that we're controlling how far they go, what decisions they're making, and making sure that they only do those longer drives when they're safe to do so. So from the cognitive screening side, I will get a picture of what they are like with the off-road assessment and some of the tests that I do with them. I usually find that that is mirrored with their driving. So for instance, if somebody approaches questions very quickly, they complete them very fast, but they're not actually reading them correctly, and they're not really paying attention, I will often find that when they're on the road, they see scenarios in front of them and they react far too quickly. They try to go when it's not safe to do.
The capital of the...
Or with people who really struggle to answer some of these questions. So for instance, they take a long time around what's relatively simple questions. Often what I'll find is when they're approaching a complex scenario on the road, they will pause and they will just stop even when it's not safe to do so, even when they should proceed and they flow with the traffic. So I try to take that picture from the off-road assessment and see how close does that mimic when we do the on-road assessment. So when we talk about cognitive impairment, even clients with no cognitive impairment can struggle to answer questions and appropriately judge road scenarios. Now, the questions that I'm going to take you through next are examples of some of these questions that we ask all of our clients. I think I put at the end here, I did this assessment with a client of mine who was a lawyer, and she took over 30 minutes to answer the next 4 slides. I would normally expect somebody to answer these within a couple of minutes. She overthought every scenario that was there. And after a few minutes, she would usually come back to me and lots of questions. But what if this occurred? Or what if that occurred? And what about this scenario? This is the kind of screening that we're looking for, because as soon as we took this person on the road, she overthought everything. She would drive up to small roundabouts and completely stop. And we would say, why did you stop there? Well, maybe somebody was going to pull out of that driveway. Like, well, we need to rationalize that with you. What was the likelihood of that happening? What are your thought processes around it? When we asked her to navigate to certain areas, even when she was familiar with the area, she really struggled, because all of a sudden she stopped to think, well, what if I go this way or that way? And did you want me to do this? When really it was severe overthinking of what we were looking for. So let's take you through a few questions. Now, these questions were not set by me, and some of them are open-ended. Some of them can be a little hard to understand, and because they're written for a number of geographic locations, some of the terminology can be a little strange. When the questions say things like uncontrolled intersection, which can be difficult for a client to understand, what we mean by that is there's no traffic lights, there's no stop, give way. It's a case of who approaches the junction first, what happens next. So I don't want you to shout out any answers, but what I want you to do is I'll give you a couple of minutes with each question, and I just want you to think about what your answer would be. And as we get through each page, I'll tell you what the accepted answers are. So, first question here. What should you do on a highway without lanes when a driver behind you signals his or her intention to pass your car? So do you slow down? Do you drive to the left and not increase speed? And do you continue driving the same manner as before? So highway without lanes just means general road. There's no solid white lines. They have the ability to overtake you if they're traveling at a faster speed to you. How do you react to that scenario? So hopefully you've had to think about that. It's very interesting where most people will answer C, continue driving in the same manner as before, which is the correct answer. If somebody wants to overtake you, that's their responsibility to overtake you. What we want is people driving in a predictable manner and not suddenly driving to the left or braking or doing something that the driver behind them doesn't expect. A lot of people would say drive to the left and do not increase speed, which is quite a courteous thing to do. What I find is A and B is often answered by people who've been in major accidents, because a car is coming up behind them and their first reaction is, I need to get out of the way because somebody has crashed into the back of me before and I don't want to be in that scenario again. So question 2, you're facing a traffic signal showing a green light, right turn arrow together with a red light. What does this mean? So you can proceed when both are green, you will proceed only in the direction of the arrow, or you may proceed straight ahead. Relatively simple question. Some people struggle with understanding questions with too many words, so I'll often draw traffic lights and say, in this scenario, hopefully you all answered, you may only proceed in the direction of the arrow. The next question is an interesting one when it comes to how aggressive people can sometimes drive. So is a driver turning at an uncontrolled intersection required to give way to pedestrians? The answer to this one always creates debate. If the driver is turning left, he or she must give way to pedestrians. The pedestrians must give way to the driver. Or C, a driver turning right or left must give way to pedestrians. The actual correct answer here is the driver turning right or left must give way to pedestrians. However, for those of us living in the major cities, it's not always the case. Question 4, people varying the amount of alcohol they can drink before reaching 0.05 blood alcohol content. Suggest 2 reasons why. If anyone's ever done a responsible serving of alcohol course, they'll know the answer to this one. Hopefully you're able to answer pretty quickly. It can be all sorts of answers. It can be body size, it can be age, it can be gender, it can be a variety of reasons. So list 4 hazards you look for when driving through a shopping area's parking lot. So again, a relatively straightforward one, very open-ended. Anyone who shouted out things like trolleys, people reversing, parents with buggies, all of these are really good answers. How do you change lanes? List the 4 steps involved in order. This is a good one to actually watch people suddenly look and turn, and you can see in their head they're processing how to do that. So there is a set answer for this, but I'm relatively flexible on some of the answers. What we want to know is, are you indicating? Are you looking in your mirrors, checking your blind spots, and then moving appropriately when you need to? So personal factors that could affect an individual's driving. Some of the answers that we get here that like really good answers are things like you woke up in a bad mood, you're irritable that day, you've had a bad night's sleep, for instance. It could be you're distracted by somebody in the back of the car. Any of these can affect your driving. Question 8 for any of my clients, most of my clients answer this instantly. What should you do if you're involved in an accident? They tell me exactly what they did. So pretty straightforward. Lots of open questions here, but what we want to know is you pull the car over to a safe environment, you check that everyone's okay, you call emergency services if you need to, you swap your details, anything like that. So on our next slide, I'm going to give you some road scenarios. If there are no traffic lights, give way signs or stop signs, assume that everyone approaching the intersection has the same right of way. So what I want you to do is, in order, think about what car would go first, what car would go second, what car would go third. Now, in some of these scenarios, more than one car could go at the same time. If that's the case, just try and think in what order would they likely proceed. Now we've got 2 here. So if you want to have a look at the first one, relatively straightforward. Hopefully nobody got this one wrong. So B would go straight through, A goes around the back of them. Scenario 2, a little bit more complex. A or C could go at the same time. B struggles to go after them. So I'll blitz through a few of these. A little bit more complicated, number 11. It's interesting, I always ask people to explain to me why they answered correctly, and some of their answers can be really good. In this case, C is obviously going to go straight through. I would generally consider that A would go around the back of C and turn, and then B would go after. Some people would say slightly differently. B and A are fairly interchangeable here. We get a little bit more complex down into number 12. The first one is pretty straightforward. C goes through, there's nothing stopping them. And then we have our 2 stop signs. Stop signs are very few people actually stop at stop signs. Most people do what's called a rolling stop. They roll through, and if it's all good, they treat it like a giveaway. Stop means you have to stop. You have to come to a complete stop, and then you can move forward. And you have to come to a complete stop before the line. So in this case, B would stop, A would stop, but because B has to turn right, they have to give way to B. Because A is turning right, gives way to B, who's coming straight forward. And we have our scenario here where C has a give way, A and B can go in either event, C gives way. And then our complex one to finish with, give you all a few seconds to have a think about this one. The important thing to try and think is, who is not restricted by any other road user? So as you can see, A and D are not restricted by anyone. B has a stop sign, must come to a complete stop, so C can go through afterwards. Now, we just took about 2 to 3 minutes going through them. My client took 30 minutes to answer these questions. So as you can see, that nervousness about every road scenario, the overthinking of every situation, that's where the concerns start to lie. And all of a sudden you start to think triggers of, okay, we're going to have some difficulty with problem solving, and how quickly you react in what can be very fast changing environment. So I've just got a couple of quick case studies for you. I've obviously changed the names of these clients. So, look, our first case study, I'm going to call him Jason. He was involved in a major truck crash. So he was the driver. A car on his inside left tried to undertake him, pulled out very quickly in front of him. He didn't have time to fully react. So he tried to steer around them, rolled the truck, and crashed into another vehicle. So he suffered some pretty severe physical injuries. He had a reduced grip strength on his right-hand side. So from memory, I think I tested him about 40% reduced on his right side to his left, which was his predominant side. But really what was restricting him was PTSD. He had severe nightmares about the injuries he caused to the other driver when he rolled the truck. He had he used to have nightmares that he was falling out of bed because it was falling out of the truck and he'd be on the edge of the bed and he'd be rolling. He hadn't driven in 2 years and he was nervous to even be a passenger in a car. So he had a 3-year-old, I think, 4-year-old child, and his partner had to do all of the school drop-offs, school pickups. He hadn't worked in 2 years. He had a vocational rehab provider, but he had been a truck driver all of his life. That was all of his background. And even just getting anywhere was so difficult for him. When he sat in an Uber, he'd hold on to the side bars or hold on to the seat. He didn't like being a passenger because he wasn't in control, but at the same time, he couldn't drive. So it was a real struggle with him on the assessment. Now, we did get him on road the first time around, but he would not drive above 20 kilometers per hour. So we had to keep him in very local roads, lots of people beeping the horn at him, lots of people getting very frustrated. A number of times we just had to get him to pull over, let the traffic pass and drive on. Now you can imagine if you are late for an appointment and you've got somebody like this behind you, all of a sudden becomes not just frustrating for you, but people react and try and overtake you in places where it's not necessarily safe to do so, or they try and cut you off and pull in front of you because they're worried about getting stuck behind you. So it creates hazards around for other road users. We had him driving for probably about 40 minutes. At the end of it, he was exhausted. He had back pain, he had shoulder pain. And the reason for that was he was sitting so far forward and gripping the wheels so tight that it just put so much stress and load through his body. So I downgraded his license. I put him on L plates. Part of the reason for putting him on L plates was when somebody sees L plates, they think this is a new learner. They're going to make some unpredictable road choices. I'm going to back off and give them a little bit more space. So it gives a signal to other road users. This person might react in a way that I don't expect. And we started him with a program of driving lessons. So the first thing we had to do was just get him comfortable behind the wheel again. And it was a lot of repetition, driving around local areas, lots of encouragement to increase his speed. I'm a big believer in constant positive reinforcement. At the end of every lesson, what have you done well? Tell me about what you've achieved. We're going to talk to you about what you've achieved. Every one of my clients can tell me every mistake that they've made instantly, but very few of them can tell me anything they've done well. So I always want them to focus on those positives and try and build from there. We worked with Jason after about 6 months, we cleared him to come back to driving in a 5-kilometer radius by himself. He really built up his confidence driving up to about 40 kilometers an hour. But as soon as it got to about 40 kilometers an hour, he started to panic again. And that's when cars merging, he was just that little bit slower reacting to them. He would brake, he would pull over to the side of the road rather than deal with it. But what we were able to do from just that 5 kilometers an hour was get him back to an independence level where he could drop his child off to school in the morning and pick him up at the end. And that was such a relief on his partner because Jason wasn't working, she was working, but she still had to do the pick up and drop off every day. And it just meant that he was back to doing that little bit of independence. And he really felt so much better in himself. So I've discharged Jason now. We have him back driving, but he will never drive a truck again. He's unfortunately, just the thought of even trying to do that is just far too much for him. But from a vocational perspective, you've got a young man who wasn't working, hasn't worked in 2 years, and has lost all of his independence. And just to get him back to that stage was such an achievement. I'll just quickly talk through about Kay. As you'll see with a lot of these scenarios, a lot of them are very similar. So she was in an accident that wasn't her fault, but the other driver contested it. And she just felt awful about this. She felt guilt. She started to question herself. The process between the investigation that then had to happen made her really angry even talking about it. So she attended her psychologist. Her psychologist, in good faith, tried to really help and encourage her and told her, well, you need to get over this. You need to get back in the car and you need to just drive this. So she got back in the car, she got really nervous and she crashed into another vehicle. It was her fault. But you can imagine how much that set her back then, because all of her thoughts were, well, what if I'm in another accident? And the first time she sits behind the wheel, she has an accident. So it had been 6 months since that had occurred when she got referred through to us. It was actually her psychologist who referred through to our service and asked us if we could help. When I came to see her, she was visibly exhausted. She hadn't slept the night before. She told me about how she'd been thinking about it for days. She hadn't eaten properly. Unfortunately, her job had meant that she traveled a lot for work and she had had to quit her job. She was really struggling when I saw her. So we did the assessment with her. She was one of the drivers who just stared at the road in front of her and had no idea what was going on around. She couldn't read traffic signs. She was slow to react to vehicles that were approaching. Everything around her was just a real struggle. So again, I restricted her license. That also allowed me to put L plates on her and allowed everyone else to understand that we've got a driver here who's potentially not going to drive in a way that you predict. And we started driving lessons with her. So the first 10 sessions was about getting her to relax, getting her to scan the road around, lots of commentary driving, tell us what's around, what was the color of that car, get her to scan the road. And that really started to improve. And then we started to expose her back to the crash site. She crashed near to home. So we just didn't think there was ever going to be a scenario where she wouldn't have to go through at least close to that area. So we had to try expose her to it. The first time she drove through there, she closed her eyes and drove through, which you can just imagine how scary that was. And she was cognitively exhausted. So look, she's another one where we set really functioning goals. So we said to her, look, you want to return to driving? We want to get you back picking up your shops. We want to get you to your child's daycare. All of these, setting these goals that really make a difference to somebody's life. And what that means is they really strive harder to achieve them than just, I want to drive again. So we're still working with her. She is able to drop her kid at daycare. She is able to go to the local shops and back. She drives for a coffee nearby. She keeps telling me she's going to take me for one. But her goal next is to return to driving on multi-lane highways. And that's going to be the struggle for her because it's the cars suddenly zipping in front of you, hitting gaps, all of those things. But as you can see, from where we started with her, it's a massive functional change. So just quickly in conclusion, like capacity to drive following a traumatic accident, like it's often not considered. If somebody doesn't have a physical disability, it can be forgotten about how they actually cognitively react to environments because of a mental health condition. It can take a long time for somebody who's been involved in a major accident to get back to driving again. That confidence building can take many, many months. But with support in a tailored program, most clients we see are able to regain their independence again. Not all of our clients get back to their pre-injury level of driving. But what we can do is we get them to a point where, at least functionally, their life is improved from that. And what I advocate for, if there's any concern about a person's safety or ability to drive, the NOTI Driving Assessment Intervention Program is recommended. So that's my presentation. I hope some of that made sense. Look, if you have any questions, I'm really open to them.
Tom, that was great. I almost could feel myself being assessed to how well I could drive by you. And I feel pretty good that I got all those little driving scenarios right. So I feel good about that. That was really, really comprehensive. And there was elements of that I hadn't appreciated about it. I think most of us think about old people who are getting a bit doddery being the ones who get assessed and we forget about people who are traumatized by motor vehicle accidents. So there's not only the physical injuries that come with motor vehicle accidents, but life-changing trauma like that. And what amazing work that you do in that space. Does anyone have a question that they would like to ask of Tom? Nope. Okay, Tom, sorry, you're about to say something.
So with regards to the older age driving assessments, I think they're ones that most OTs would do on a fairly regular basis. I actually do work with Neurological Research Australia, so I do a lot of older age driving assessments, but also on a general population as well as people who have a disability. And it is very evident very quickly where you can see actually where somebody is starting to struggle, because people do panic. Everyone panics when they're like, somebody's going to watch me park now, or all of a sudden I've got to do a parallel park and I've got two strangers sitting in a car looking at me, judging me. It is difficult, and we do try and reassure and keep people as relaxed as possible. But it is very obvious the difference between somebody who's not necessarily a great driver, but safe to drive, and somebody who is really struggling from a cognitive perspective.
Yeah, absolutely. Look, thank you so much for that. It was really insightful. We're very, very grateful to have you coming to us with this. And I know this is going to get watched quite a lot. Oh, here's a quick question. The question's about grip strength. Let me just open that one up. Is there a minimum grip strength required bilaterally to grasp the steering wheel safely?
So there isn't, but I will make a therapeutic decision on where their grip strength is and whether I feel that's going to be sufficient. So if I know that somebody's got an injury and their grip strength is reduced, so I'll always do essentially an informal test. And if I can feel that somebody's grip strength is weaker, I'll test it using what's called a dynamometer, which gives me a figure on their grip strength. And if that is particularly low, what I'll do then is I'll actually apply a little bit of force and see how they push the wheel. Now, if there's a concern, then following on from that, before we even commence the drive, I'll get them to try and turn the wheel. And if they struggle with that, that's when we know we might have to make some changes. You legally have to be able to drive with both hands on the wheel, and you have to be able to safely turn the wheel, but there are modifications that can be done around that. The simplest one is what's called a spinner knob. So you attach it onto the steering wheel and you can turn with that. With the spinner knobs, you can even add indicators onto that. You can add turn signals. You can add lots of electronics as well. But if somebody requires that, I will then put that as a restriction on their license, and they will only be able to drive with one.
Right. All right. Well, thank you, everybody. We're going to wrap it up now. As I said, hang on, we've got one more question. Have you done assessments that are used to show how the accident has impacted on the driver? For example, a Medico-Legal style report.
So I was actually going to include a piece on that today and last minute backed out of it, but I'm glad somebody's brought that up. So through some of my medical legal assessments, I have seen recommendations where people have said to do an OT driving assessment for somebody, and they've costed what that is within that context. The difficulty there is the OT driving assessment itself, the cost of that as a one-off is often much, much less than what the actual intervention program is after it. And it's very difficult to identify what that is unless that assessment is actually conducted. How feasible it is in a medical legal scenario to actually push somebody through a whole driving assessment to then determine what an intervention program is. I mean, there's funding questions and things around that. It becomes a lot more complicated. I haven't been asked, but I think particularly with these mental health claims where the intervention period is likely to be for a longer period of time, I wouldn't be surprised if I start getting asked questions around, can you actually tell me what this program would be and how much would it cost? I hope that answers that question.
it's such a thank you they've got. Such a broad area, isn't it? Well, look, everyone, thank you. Please join us again for our next seminar. And of course, this seminar, you will receive the recording within the day, and it will also be on our YouTube channel. And for those of you with a Mag Connect login, you can click on the word seminars in the side menu and go straight to the seminars. Once again, thank you so much, Tom. Thank you, everyone, for giving us your time. Have a great weekend, and we'll see you next time.
Thank you now.